with a conventional slit lamp, there's a lot of handwork you have to do to get to the right height, to the right angle, and all this kind of stuff. And of course, you get a certain routine with a conventional machine. We usually don't document because it's too much work or too much hassle. Now, you can exactly photograph what you want to see, and you can look at all angles and make it very nice. This is 100% better than what we had before. Then you can show it to the patient also. And you can, depending on the setup in your clinic, you can transfer it to the patient file. We are still working on the DICOM and the stuff so that we can use it and integrate this fully in our documentation system. And then more or less in every patient, we may have some photo documentation. And nowadays we have it extremely rarely compared to the need we would have for. Well, I think it's a kind of equal win-win situation. First of all, I personally feel more comfortable having a advanced and a nice machine to show that to the patient. With this, you can preset things. It goes smoother, faster. It goes automatically. You can see that you are not using a mechanical device, that there's a lot of electronic in it. And this actually makes it a more modern feeling when you do that. With a better view, you can do better diagnostic. You can document it better and then remember it when you compare it to the next follow-up. So this has a clear advantage to the patient. Also, you don't need to send the patient around in the hospital to make photos, then check the photos in another system. So everything is much more efficient, faster and sleek, and independent from the way you handle the machine. I think it's a win-win situation for both. And there are older doctors that are used for 30 years on their old slit lamp. They are just not used to it, and it takes them longer to adapt to that, whereas the younger people don't even think about it. All of them like the quality, the high resolution imaging they have. The older ones are happy that the new machine is as good as the old ones. That's the only concern they usually have. No, that's not really an issue, but the documentation and all this kind of stuff and the clarity of vision is something they all have in common. Yeah, the trainees, they even will do it more. And I think they also will use it for remembering diagnosis and special cases. This is what usually you learn most in a residency. If you read about it, you don't remember it. And if you make yourself a photo of it, you also have it better in your brain. It's more than a slit lamp. Yeah, and especially a university setup that I can also use it for showing patients or students or doctors. It's really much better than what we had before.